My name's Matt. I'm a PA here at VIP Health and Laser. So I just wanted to share a couple of words about how BART's high-energy shockwave treatment works. Now, there's a lot of modalities out there. A lot of patients come to us with a tendonitis or a joint pain or a chronic issue. BART is a high-energy ESWT specialist. What he does is nothing short of amazing and
miraculous. I mean, it does.
I got into offering this procedure here is because he actually fixed a tendonitis that I could not fix with all the common modalities out there. So I'm not just a provider, I'm a patient. So, when a patient comes in with a problem, we evaluate it, we look at the exam, we find out what they've been through, what's worked for them, what hasn't worked for them. Usually most things haven't at this point, and they come in, mark off the spots as a starting area, not just where the tenderness or the exam directs us to do it, but also where imaging such as an MRI or X-ray can also help.
I would explain to them a little bit about your shoulder and what you felt when the procedure was. They want to know.
Yeah. So as a patient, when you're getting this procedure, you're going to feel energy extremely deep into the joint and tendon that's inflamed. So say if you have a shoulder problem or a hip problem, knee problem, you sort of prod around, you see what hurts. This device, when it starts working, you're going to feel it right on that spot, when focused onto that spot when he finds it. And it just it'll keep hitting that area over and over until that pain starts to get better and it pushes inflammatory mediators out of there. So the procedure takes 30 minutes up to an hour. Sometimes we need to numb it enough to tolerate some areas if they're really tender for a patient. If a patient gets really
excruciating pain, we don't want.
Yeah, and if you do a procedure on an area that's painful, then a lot of times we can numb it with lidocaine if necessary. But we always get everyone through it. It's very well tolerated. So
you should try this first, is the way I've always looked at it. This is the modality that you should try first. It's the one that everybody seems to try last, which is kind of counterproductive because you spend a lot of money out on things that don't work, but then you come here and you find out it does work, but it does cost money.
Right.